Okay, so I'm going to be talking about mathematical and computational modeling of complex systems. So this is one of a variety of different types of systems methods or approaches or tools that can be used to better understand these complex systems. So we're going to be using as an exemplar obesity. The obesity epidemic, of course, is a very complex system problem, but this really can apply to many different other types of health and public health issues. Obesity serves as a good exemplar because it really incorporates many different aspects of society, of individuals, of behavior. It's a multi-scale problem. So just to start off, many of you may have heard Stephen Hopkins. A couple years ago, he had indicated that obesity is the biggest problem that our world is facing these days. And when people within the obesity community heard that, they thought, great, because this is a high-profile individual that's bringing more attention to this major problem. The challenge, though, was the second half of what he said, when he said, but fortunately, the solution is simple. So he said, you basically have to eat less and exercise more. And that's been, sort of the mantra of a lot of people when they say they look at the obesity epidemic. But if you dig deeper, it becomes not just an onion, but a very complicated onion, because it's not that simple. As all of us know, this, to break it down to just these individual behaviors, without really accounting for what's leading to these behaviors, what's contributing to these behaviors, what are the multi-scale factors, you're really basically neglecting the big proportion of the problem. So one of the things that many in public health have been trying to do is trying to reframe what exactly is obesity. It's really a multi-scale complex problem. So one of the things that we've done is we've been building computational models to better understand all the factors and system factors that are involved. Basically, when it comes to complexity, we as humans, without the help of technology, without the help of other things, are limited in how far we can see. So it's very easy to see sort of first-degree effects. So if I push something, that thing moves. So that's great. That's pretty obvious. But then when it comes to secondary, tertiary, and maybe indirect effects, we start losing track of what's actually going on. So a computational model can really help better understand all of these complex relationships. So we've been building these platforms, which we call virtual populations for obesity prevention, or VPOP for short, has nothing to do with K-pop. These are basically a SimCity for obesity prevention. So what we'll do is we'll develop these large-scale agent-based models that represent all the different people, places, locations, and situations within a given place. For instance, Baltimore or New York City. We've done a number of other cities like New Orleans and Washington, D.C. I want to emphasize when we're developing these models, this is an iterative process. So it's not like we go and disappear for 9 months and then reappear and say, hey, here's your model. It's key to make this an iterative process. So this is very similar to how we as humans develop. So when we're born, we have very simple models in our heads. So we're born and we say, okay, I don't know what's going on. I know I should be breathing and doing different things with food, et cetera, but I don't really have an understanding of the world. So you basically use experience to add to these models. So for instance, you might touch a stove, you're like, oh, that's hot, I'm not gonna do that again. So you're adding to your decision model and telling yourself, okay, this has changed. I've updated my model, I'm changing my decisions. So basically, you start getting more complexity within your head because iteratively you're learning. And based on that model within your head, it helps guide you like, okay, where should I collect more information? What do I know and what do I not know? What's my feeling about everything around the world? So we should use the same approach when developing these models. So you're not gonna necessarily get it completely right off the bat. But what you can do is you can basically, if I can use this, you convene multidisciplinary teams to create these initial mathematical and computational models to represent the system. So this is your understanding of what you think is going on. That can help elucidate important factors, relationships, guide prioritized data collection. So when you have the model, you know what you know and what you don't know and what you need to get. You can test different policies and interventions using the computational model that help inform the stakeholders, that can help design and implement interventions, and and also informed data collection. And all of that provides more information, and then you can update the model. So it's this iterative process that goes round and round and round, just like we learn. So essentially, and I'll quickly show this video just to give you a sense what we mean by agent-based model. This is a visualization. So this is Baltimore. So for instance, we're zooming in and out to show you it's Baltimore, and that's where Baltimore is located. And basically, as we get closer, so it's the hand's got to move a little faster, you can see we've mapped out the different locations. So there's the whole street network. Each of these different things are different food sources, and there's also physical activity locations, and each of those have different types of characteristics. So shortly, you're going to see people appear. So once this moves around, click and show people moving. So each of these circles are different people. And the fact they're shaped like donuts is completely coincidental. But essentially what they do is they basically move from location to location throughout the day, just like the real person. So this person might start off at a household, then go to school, and then pass by different sources. So like if someone passes by a corner store, then he or she may be tempted to stop at the store and shop for some food, and based on what the inventory is in the store, that person will get that type of food. And there's all these decision rules that are built into each of these individual virtual people, which are called computational agents. So they're just like real people making decisions throughout the day. So essentially what we can do is we can then have them progress just like real people, and then you can see what might happen, and then you can implement different interventions at different places. So, one example is, this is a study that was published in Health Affairs. We wanted to assess what's the impact of increasing physical activity among youth. And this is challenging because, the impact is not immediate, right? So most of the impact comes downstream. So as they have different changes in their weight, that changes their risk of chronic disease, that then ultimately changes their productivity losses, changes their healthcare costs, ultimately may cut short their life, et cetera. You can't test this in a natural experiment. That would take years to do that. And also, it's an immense amount of data collection, et cetera. But we could do that with the model. We could run the model, a United States model, over a number of years and see what happens to the population. So we found that ultimately this costs billions of dollars. Because if you think about it, there's a huge impact if you're changing the weight class or weight statuses of different kids. So that received a fair amount of attention. And another example is, what's the impact of reducing someone's weight, like say an individual's weight at different ages, like age 20, age 30, age 40. Again, a lot of these savings or changes will occur downstream. So we can run these models over time and see what might happen. We can even calculate things like hospitalizations or clinic visits or the number of cardiac caths that are involved, because these are essentially virtual people where you're testing what might be happening downstream. An example of testing and intervention is when we looked at these sugar-sweetened beverage warning labels. So some of you may have heard that San Francisco in 2015 passed an ordinance that required stores to post the sugar-sweetened beverage warning labels, basically telling people, okay, sugar-sweetened beverages may lead to different types of chronic diseases, et cetera. Of course, those labels were fought vigorously after they passed. So we wanted to find out what would happen if you implemented it at different cities, because there were other cities that were interested in potentially entertaining this type of ordinance. So essentially what we did was we built models of 3 different cities, so Baltimore, Philadelphia, San Francisco, and then we, through a wide variety of different types of experiments, implemented these labels at different locations using different types of labels, like some labels were just visual and some labels had words, so that would affect who could potentially read the labels. So for instance, if it was just in English, and you had people who couldn't speak English, then they may not follow the labels as closely, et cetera. So then basically this just shows what happens when we implement it. And this is the decrease in obesity prevalence over a number of years. This is what happens when you use no labels versus labels that are 4% effective in terms of changing the behavior. So if someone saw it 100 times, 4 out of 100 times they might change their choice of beverage, 8%, 12%. For each of these different cities. Now, the one thing I want to quickly point out is the results were different based on each of the different cities. So there's a fair amount of heterogeneity. And without going into great detail, if you think about it, you're dealing with different populations, different allocations of food sources and their inventories, et cetera. So the same policy can have different impacts in different cities. And you wouldn't be able to tell this without really representing each of the cities in great detail and their populations as well. So knowing that I'm getting close to the end of my 10 minutes, this is another example of interventions that we looked at. So this is looking at crime and what the impact of crime on obesity and overweight prevalence might be. So you may think, well, what does crime have to do with those health measures? Or if you think about it, crime can be a barrier. So if there's existing crime between you and a location, you're less likely to go there to exercise. You're less likely to go there to shop or to eat food, et cetera. It can really change what you do. So we looked at incorporating the different crime patterns within Washington, D.C., and see what might happen if you just have those existing crime patterns and how it might affect the population, and what happens if you reduce crime in different areas. And we showed there was a significant change. Because if you think about it, that changes behavior, and over time, that can definitely add up. So again, knowing that I'm getting close to my limit, I won't go through in great detail the results with this, but essentially this shows how potentially disparate forces or relationships can actually be quite linked. So just in summary, obesity is an example of a health problem or public health problem, but just one example. This applies to many other issues where it can't really be explained by single cause, single effect situation. You really have this complex system of all kinds of relationships, ranging from biological to individual behavioral to social networks to environmental, both physical activity and food environments versus larger policy and economic forces, et cetera. It's really difficult to pull all these together without the benefit of a computational model. And then basically a systems approach incorporates all these complex factors, and again, emphasizing that this is an iterative process, and this is something which you build evidence and can really help guide all the other types of studies. So this is not there to replace clinical trials or replace retrospective studies. Basically, it's a bridge to enhancing them and guiding them. And finally, really, computational modeling can help leverage all these many other trends that we're seeing that are affecting health right now, such as wearables and big data. So we're in a situation where there's an unprecedented amount of data, but it's not clear how to use this data. So the problem with big data, of course, there's lots of it, and if you misuse big data, it's simply just misusing larger amounts of data. But the issue is this big data is undirected, so when you use systems approaches or computational models, it can help guide the use of this data and actually really frame, how is this data relevant to everything else? And the same thing with wearables and other types of trends like AI, et cetera. So that being said, I move on to the next speaker, but thanks for your attention.